At this point, we're actually going to bring Derek Knight from the European Chemicals Agency in by video conference. Derek couldn't be with us today, but we did want to get his perspectives, and so Derek will be our next speaker and see if our technology works. Aisha?
Hello, this is Derek Knight from the Chemicals Agency in Helsinki. Can you hear me?
Yes, Derek, it sounds like it's coming across well.
Good, and can you see me?
We can.
Good, okay. Well, thank you very much for inviting me to give this talk this afternoon, according to Helsinki time, this morning, according to your time. And it's quite a challenge, actually, to talk about the European experience with emerging technologies for hazard and risk assessment. What I'm going to do this, in this session is to give you experience that the Chemicals Agency has in using non-standard information. And in a way, I'm looking at this in a very practical way as a regulator, as a regulatory system, to actually assess the hazardous properties of a substance so that a chemical substance, to an extent that's good enough for hazard and risk assessment. So really I'm focusing in on how non-standard information can be used to replace the classical animal data or the environmental data, rather than just thinking about using it for priority setting. Okay. My colleague Maurice Whelan, I think, is with you, so he can take any very difficult questions on the scientific aspects, and I'm sure he'd be able to answer any other questions during the coffee break discussions and so on. So again, my apologies for not actually being able to be present. What was interesting was I was at a meeting earlier this week. It's called Accelerate, and it's a European Commission. I'll tell you a little bit more about it later. But there were various people from the US. There was Mel Anderson, Tom Hudson, and Bob Kavloff from EPA, and they were talking a little bit more about the US approach, and the emphasis seemed to be more on priority setting or making use of sophisticated information as a part of a weight of evidence approach. So I'm reiterating that what I'm talking about now is making use of non-standard information in a sense to fill information gaps. So to set the scene and to use REACH and CLP as an example of how non-standard information and new approaches can be used within a regulatory framework, I want to give you a little bit of a sort of briefing, primer on what REACH and CLP is. First of all, the Chemicals Agency, the European Chemicals Agency, runs the system, administers the system, but there are various other really, really important actors, industry and the national member states, that take big responsibility, and of course the European Commission, that take big responsibility for the success of REACH. And the obvious aim of REACH is to protect human health and the environment. But one key element, and this is the second bullet point, is that industry takes responsibility for establishing safe use of manufacture and use of chemicals throughout the whole life cycle in Europe. And the point is, in some ways, part of what REACH does is to provide a framework for this to take place, for industry to obtain the information, analyse it in terms of risk assessment and hazard communication, and then disseminate it down the supply chain to the downstream users, and for ECHA to facilitate making that information available to the public. Okay. The main point is we're not aiming to be perfect, but we're targeting the activities to get the maximum effect. So it may be that sometimes the information on the properties is not perfect, but it's good enough for the hazardous properties assessment and the risk assessment. Okay. One of the aims is to get enough information on the particular substance for hazard identification, hazard communication, and so that industry can make sure that when they've done the risk assessment, that the risks are properly controlled by appropriate risk management measures, so that there's no unacceptable risk to human health or the environment. Another really important thing is dealing with the burden of the past. dealing with all the old substances that were in effect grandfathered into the system in a prioritized way. So really what we're doing is we have a sort of, in effect, a high production volume chemicals assessment program dealing with virtually all the old chemicals. Any chemical above 1 ton, so that includes low volume chemicals as well, ultimately will have to be registered by industry. I think I want to make a really important point as well, that risk assessment is central to the REACH and CLP processes, either explicitly or implicitly in the way that different processes work. And I've already mentioned that communication is absolutely essential to the success of the work of REACH and CLP in terms of making that information to the general public and to other stakeholders, but also targeting specific information on the risk to tell downstream users how to use their chemical in a safe way. Okay. Should mention that REACH stands for Registration, Evaluation, Authorization of Chemicals, which includes restrictions, and CLP is the classification and labeling scheme for chemicals, classification, labeling, and packaging. So this is a sort of pretty standard slide, in all honesty, that people at the Chemicals Agency often show, because I think it encapsulates beautifully, actually, what REACH and CLP are, because it tells you in a nutshell what the different processes are, the administrative and regulatory processes, and it highlights the different actors that are involved, and the caption at the top tells you the two main themes, main aims of what we're trying to do, which is to provide information on chemicals, part one, and secondly, to address chemicals of concern. And this, in a way, is where regulatory intervention is needed, where industry itself, where there's basically an unacceptable risk, or there is a risk, an uncontrolled risk from use of those chemicals. So the top bit is mainly in work by industry. So they're assessing the properties of chemicals, producing a registration dossier, submitting that to the agency, doing a risk assessment, which is called a chemical safety report, which is for particular use for the downstream users as extended safety data sheets. And they're doing a self-classification in terms of the GHS classification criteria for human health, the environment, and phys-chem properties. That's the main universe of chemicals. So ultimately there might be 25,000 or more, possibly, chemicals registered. At the moment there's about 4,000 substances, because we've just had the first registration deadline for the phase-in substances. And then next year we have the medium volume chemicals have to be registered. And then in 2018, the low volume chemicals. So in terms of numbers, the low volume ones will be more than the high volume, actually. Then evaluation is the middle bit of what we do. This is a proportion of the registered substances will undergo a scientific scrutiny by the Chemicals Agency here. I should say there's about 500 staff and about at least half, more than half, of scientists. And the evaluation directorate is staffed by about 100 scientists who scrutinize the dossiers and do the assessment of the information in the dossiers. A small number of substances where there's an unclear risk, where we're not clear whether there's a problem or not, will undergo substance evaluation, where the member states, the UK, Germany, Finland, etc., will look in more detail and do a really thorough assessment of the particular substance to decide if more information is needed to clarify whether there's a risk. Now that we look at the bottom part, this is in many ways, the tip of the iceberg. This is the small minority of substances that need regulatory intervention to deal with problem risks, basically, or intrinsic hazards that mean that there can be no safe use. For example, PBTs or CMRs with no non-threshold effects. And there are various regulatory instruments, risk management means, that can be used within the chemicals legislation. There's the authorization process for substances of very high concern. There's restriction, which means any substance could be banned if it's shown that there's an unacceptable risk. And then there's what's called harmonized classification labeling for carcinogens, mutagens, toxic for reproduction substances, and respiratory sensitizers. That means that it's mandatory for industry to follow that particular type of classification. So one of the aims of the registration data set is for member states and the European Commission to pick substances that need regulatory intervention for this bit at the bottom here. Okay. Now, the other message I want to show you from this slide, the next slide, is that non-standard information is that there are provisions within REACH and classification labelling scheme to use non-standard information. The door is unlocked, and industry, or the data provider, which is usually industry, have the opportunity to push the door open and use non-standard information. REACH, of course, is only, the agency started operating 5 years ago. REACH has been running for 4 years. The legislation was developed perhaps 6 or 7 years ago. So it's very modern legislation. It makes provision for using non-standard information. So this slide shows you the steps that industry must take when they're preparing their registration dossiers. First of all, they have to collect all the available information, and basically they have to share the information. They're not allowed to do new studies without sharing the information and collecting the information together first. In other words, that's an animal welfare matter to avoid doing any unnecessary testing and to avoid repeating animal studies that other companies may have or may choose to generate to fill data gaps. Now, the information that's needed for registration, whether it be an old substance or a new substance, depends on the tonnage. And it's a stepped process, so the higher the tonnage, the higher the information requirement. So for below 100 tons, you basically have the minimum pre-marketing data set from the OECD, more or less that. Anything above 100 tons, higher tier studies are needed, and that's decided by industry submitting a testing proposal to propose to do these extra studies, such as the 90-day study, etc., or the more sophisticated environmental studies. And then ECHA approve that, and then the companies do those studies. But in order to deviate and avoid doing the standard OECD, EU type methods, companies can make use of this, I call it the Magic Annex 11, the adaptation to the standard data requirements to provide non-standard information. So they can use existing studies, in vitro studies, epidemiological information if available, and the things at the bottom here are the ones that are really very important actually. Use QSARs for certain toxicological and ecotoxicological and phys-chem properties in particular, but categories and read-across, grouping and weight of evidence are really, really useful and have been used quite extensively by companies, and I'll show you some results from the registration database in a moment. But first of all, I want to point out, when can you use non-standard information? When can you adapt the standard data requirements? And basically there are three things to think about. One is that basically, if you're using non-standard information, you basically have to provide the equivalent, broadly the equivalent information to that which you'd get from the standard information, from the standard study. So if you're substituting, if you're wanting to avoid doing a 90-day oral rat study, subacute rat study, you'd need to provide more or less the equivalent information that you would get from a 90-day oral rat study, more or less. And what does that mean, more or less the same? Well, you have to think about the duration, the route of exposure, etc. But also you have to think, is the information adequate for classification in terms of its hazardous properties for communication? This is this GHS harmonized classification scheme. And also, is it good enough for risk assessment? For risk assessment, usually done by the companies in their chemical safety report, which is communicated to the downstream user, for which they take responsibility for deviating or moving away from the standard risk assessment process. Sometimes the chemicals agency or the member states do a risk assessment if we're going to justify banning a restriction proposal, for example. Now, when the risk assessor, industry, or indeed the member states preparing their own risk assessment for these regulated substances, if you're going to use non-standard information, you have to have a scientific explanation which is thoroughly documented to explain why the non-standard method is good enough for classification, risk assessment, and filling data gaps, basically providing data. And often that means having a hypothesis why the properties of a substance can be read across, probably with using supporting evidence. Now, I'm going to sidestep a little bit now, before I talk more about different methods and the use that have been made of non-standard methods, and tell you a little bit about the chemical safety assessment, chemical safety report that's required by industry for all substances above 10 tons, because it's really important to understand the context in which the non-standard information is used to decide whether it's okay and whether it's good enough for the risk assessment. Now, all companies that supply substances above 10 tons, so that's sort of medium volumes, low to medium volume substances, have to have a chemical safety report, which is basically a risk assessment covering the substance manufacture and use throughout all stages in the life cycle in the EU. And what the intention of this really is to communicate in a very simple way to the downstream user how they can use the substance in a safe way. In other words, the operating conditions and the risk management measures that they have to use in order for there to be no unacceptable risk, to control the risk. Okay, so this is really central to the whole thing. And there's lots and lots of guidance which tells industry how to actually do the chemical safety report, how to actually do the risk assessment. And the bit that's very important in terms of the mammalian toxicology, the health effects, is thinking this newish concept called derived no effect level. Now what this is really the concentration in the air, or the exposed concentration to humans, the level at which adverse effects should not occur. And this is based on the toxicology data set using an assessment factor. So it's in effect a repackaging of the sort of margin of safety concept. But it's meant to be more accessible and usable to the downstream user because it's more understandable and easier, because you just simply say, is the exposure level below the DNL? And of course you'll have different kinds of DNL for inhalation or possibly for oral exposure, dermal exposure, of course. And you may even have short-term toxic effects and long-term toxic effects. So you can have a set of DNLs for a particular substance. So the key thing really is that you have a set of toxicology data and then you apply assessment factors, which are sort of the safety factors that you'd have in a margin of safety approach. And then, but the risk assessor can deviate from these standard assessment factors to take account of either more uncertainty in the data set or less uncertainty. So, in theory, if you've got epidemiological data, you may have an assessment factor of 1 or 2 or 5 or whatever. But if you've got non-standard information, perhaps predicted from read across, you may need to take a higher assessment factor to deal with the extra uncertainty by having a predicted property rather than a property determined by a 90-day subacute study, for example, as a model for effects on humans. Now, after that slight digression and explanation about the context of using information, I want to tell you a little bit, with a couple of slides, of experience from our registration process so far. Basically, there was a report published last year, and you can get it on our website, which collects together the information on the substances that were then registered. So, in other words, it's from the first registration deadline, which was completed the year before last, and the new substances which have already been registered or grandfathered into the scheme from the old notification scheme that was a sort of predecessor to REACH. And it's quite interesting reading. I mean, there's difficulties in actually analysing the data because we obviously couldn't open up all the dossiers for the 4,000 substances. So it was done. The work was done in a sort of automated way, and we were relying basically on the quality of the information that was submitted by the registrant when they filled in their Euclid dossiers and submitted them into REACH IT. So of course, if the information was presented incorrectly, then we'd no way of actually knowing that at this stage. The evaluation work would systematically go through and check a proportion of the dossiers, but this was to try and get an overview of the whole database. And what's interesting is the yellow bit. The yellow bit is alternative methods. This means non-standard methods, basically. The blue bit is endpoint study records, which means actual test data was submitted. Okay, we've no idea, we're not saying that they're good quality data or bad quality data that was submitted, we're just saying this is the self-assessment by the registrants, if you like. And it's interesting to see that a proportion, perhaps a quarter, perhaps a third, of the data elements were filled by alternative methods. Okay. Now, to pick one particular endpoint, or set of endpoints to look at in a little bit more detail, this is repeat dose toxicology from this report last year, of the snapshot of the situation as it was last year. So this is all routes of exposure and all durations of repeat dose. So it's 28 day, 90 day, etc., etc. And it's interesting that about 30% of the data points were filled, the endpoint summary records, were filled by read-across data, and another 20% were data waivers, this FO column. So roughly, if you think about this, a good chunk, nearly half the data elements were non-standard information. In other words, not actual studies. So this has got us all thinking, basically. And because companies are encouraged to make extensive use of predicted properties, providing they give good enough information for hazard and risk assessment, in all honesty, there was sometimes a bit of a challenge in industry to get industry to do this, because they're understandably concerned that the information may not be good enough and they may have a problem with getting the dossier accepted. To a certain extent, this is a difference in mindset compared with the old system where there was a regulatory approval process for new substances. And as I said in my earlier slides, the burden of proof is on industry to establish safe use. So to some extent, it's a self-certification scheme in a way, a self-evaluation scheme. So I think possibly some of those misgivings were misjudged. But having said that, industry are supposed to provide information to the best of their ability using the guidance that's available. And there is a lot of information, a lot of guidance on how to use non-standard information. You can get this on our website. But anyway, cut a long story short, we had a workshop in September 2010 at the agency on the use of non-standard information and the extra, in other words, the uncertainties associated with non-standard information, to try and get some sort of consensus view amongst colleagues at ECHA and the member states about what sort of challenges there would be in using non-standard information. Largely, we were focusing on categories and read across and weight of evidence. And one of the key findings was that it's really, really important to document the read across hypothesis and justify it, often using multiple lines of evidence as a weight, in a sort of weight of evidence approach. You can use a data matrix to populate the hazardous endpoints for the category members, and you can supplement it with QSAR predicted properties. And you can often make use of physicochemical properties to help in justifying a category or read across and the effects in biological organisms and models for human health. Important to consider toxicokinetics because that improves the robustness of the case and strengthen the arguments based on common breakdown products, providing you've got supporting evidence, information, arguments or actual data to support this. And this is leading towards building the case around a mode of action or other mechanistic theory, hypothesis about why the category or the read across works. And leading on from that workshop, and based on our experience over the last 18 months in actually looking at registration dossiers where there are read-across cases submitted by industry. And I should say this has been a big part of our work, actually, because we've had to, the evaluation directorate of 100 staff have spent a lot of time opening up dossiers and looking at the what I spoke of as the higher tier testing proposals, and a lot of those make use of read across because companies will be saying they've got a series of similar substances in a grouping and they want to test one for, say, the 90-day study and read across to the others. So in order to assess whether that's okay, we need to have a look at the read across, the grouping arguments. So what we've done is we are in the process of developing this read across framework, we call it a RAF. And this was presented at the OECD meeting about a month ago. And the idea is to have a framework for the assessors at the agency to examine read across cases, and we think it'll also be useful to industry or the companies that are actually, or the organisations that are actually preparing the read across cases, so that they get an insight into what we need, what we think is scientifically justified within the regulatory context of REACH and CLP. Tier 1 is a pretty obvious one. It's a screening out phase. So any case that's obviously rubbish or obviously fantastic, a no-brainer case, they're sifted out during the routine scientific assessment. But a majority of the cases actually get fed through to a detailed scientific evaluation by experienced scientists in a team. And and this is the Tier 2, which is being developed at the moment. The idea is that there be a group of perhaps 4 or 5 scientists who assess the case independently and then come to independent judgments, then come to a concerted sort of overview of whether they think the case is good enough. And the bit that's quite new is to have a sort of scoring scheme with different elements of the case to be assessed independently of the read across hypothesis. And the aim is to conclude, is it acceptable or not? Is that surrogate data good enough or not? First question. And then if it is good enough, how do we deal, or how does industry deal with the associated uncertainty? So you may have a weak case which is just good enough to be accepted without having to do a new study, but it may be that the industry should have perhaps a higher assessment factor in doing the risk assessment to take account of the extra uncertainty associated with using that predicted property instead of a standard data point. And there's a workshop planned for this October with member states and invited experts with full support from the CEFIC, which is the European Chemicals Industry Association. Now, what I've described previously is, in a sense, the current situation with use of non-standard information in REACH and CLP in Europe for meeting data requirements, doing classification, labelling, and doing risk assessment. And I want to, in the last few minutes, I just want to put this into a bit of a context for what I think of as the newer methods, the more sort of innovative work that's being done. And you will see this is a slide which lists the main actors involved. And I'll go through 1 or 2 of these in a little bit more detail over the next few minutes remaining for my talk. The OECD, I almost can't overemphasize how important the OECD work is, because one element is the OECD QSAR toolbox, which is designed to facilitate read across and grouping and category building. And in fact, ECHA are involved in helping the OECD and sponsoring some of this work. Really, really important work. And then there's the Chem Portal, which is a sort of window into information on substances. I mentioned earlier that the information that's submitted to the agency for registration dossiers and indeed classification, labelling, notifications, is disseminated on our website. And in fact, that database feeds into the Chem Portal. And sometimes it's actually, if you're going to do complicated searches, it can be easier to go through the OECD portal, Chem Portal, and then find the information which you can then, it sends you to our website to download the actual information on the properties of a particular substance. The thing I want to mention here, though, is the OECD guidance on grouping of chemicals is being updated. And within the context of the new approaches, it's including the adverse outcome pathway and bioprofiling as a mechanistic information to justify grouping. And this is where we see a really, really important element in making use of new approaches by industry in, if you like, buttressing up their case, supporting their cases for categories and read across by some form of bioprofiling information, especially if it's based on mechanistic information, the adverse outcome pathway approach. Now, Surat If you're interested, the name comes from the French painter, 19th century painter, who painted pictures with little dots. And then when you stood far away, you got a big picture and you could actually see a piece of art. Surat, the idea there is that there's small pieces of research, relatively small pieces of research, that come together to produce an overall predictive model for 90-day oral toxicity. It's jointly funded by the European Commission and Cosmetics Europe. They used to be called COLIPA. So it's 50 million euros over 5 years, and we're sort of in our second year of this work. And the idea is to develop an innovative concept for repeat dose systemic toxicity based on, to have a proof of concept. It's only possible to prove the concept, of course, in 5 years, for a mode of action strategy using innovative techniques to actually assess the long-term toxic effects by oral exposure. And I was at a meeting last week. They had their summer school in Lisbon, and I was there, and I'm a member of the scientific expert panel. So that was quite interesting to hear the latest developments. And the first annual book has already been published on the website for last year. And the new book is very, very imminent. It should be released, I think, on the 14th of July. So you can follow, if you're interested, you can see the latest developments. And of course, people now are thinking about funding for the next steps in Surat 1. And talking of funding, this links in with a second project, a big EU project called Accelerate. This is a coordination effort to help coordinate the existing, almost ad hoc, dare I say ad hoc, projects that have been EU funded to develop non-standard methods or in vitro tests. And there was the main purpose is to get companies together, to get the research projects together and to coordinate the activities and think about streaming the regulatory acceptance of these new techniques and to network and to think about further funding. And actually, by coincidence, this is actually one of the main reasons I'm not able to join you today, is apart from going to Lisbon last week, the Accelerate had their third annual workshop at the weekend, or earlier this week, and I went to Berlin to give this presentation I'm giving to you now, actually, in all honesty. And it was extremely, extremely interesting because we were learning about the new EU funding project. They used to call them framework programs, FP6 and 7. Framework Program 7 is the current one. But that runs out soon, and the new one is going to be called Horizon 2020, and that the work will actually start in January 2014. But the calls for research for areas of interest are already being written by the Commission. So this is very, very interesting. And one of the purposes of this workshop, Accelerate, was to think about how the OECD adverse outcome pathway approach could be used for adverse outcome pathway orientated funding calls under this project, under this Horizon 2020. And I attended a working group, a breakout session on the skin sensitization. And this could be a very good way of using innovative techniques within a regulatory context to get definitive information that's good enough for hazard and risk assessment within the REACH and CLP contexts. Because the OECD have already more or less finalized their adverse outcome pathway for skin sensitization. And the EU ECVAM, it's called the EARL, the European Union Laboratory Research Reference Laboratory, ECVAM, are thinking of developing an endpoint-specific roadmap to populate this adverse outcome pathway matrix with tests to support the key events in that matrix. So ultimately, this could lead to an endpoint strategy document. So it could be, in a way, low-hanging fruit for a way of actually predicting the properties for skin sensitization for a very, very important endpoint in the REACH context, because for the 2018 deadline for the low-volume substances, most of these substances will need to be assessed for skin sensitization. And it would be really good if there was an alternative technique available to reduce or even eliminate the use of the new local lymph node assay tests. And in the last couple of minutes, I just want to highlight this EPA, the European Partnership for Alternative Approaches to Animal Testing, point out that recently we held the Helsinki Chemicals Forum, and there was a panel discussion. It's very topical, all these issues of non-standard information. There was a panel discussion on the use of non-standard methods for long-term toxicology, and what are the bottlenecks affecting regulatory acceptance. And my colleague Jukka Malm, who is the deputy head of the agency, led that panel discussion, and there was a very, very interesting discussion by the OECD, etc. And the aim is really reiterating that using an adverse outcome pathway or mode of action approach is the way forward, and that there's no real shortcut to predicting properties from scratch without having a mechanistic understanding of the biological process. The exception, of course, is if you can use these new techniques to justify and add evidence to the categories and read across approach. The other bit that was interesting, and this keeps coming up actually, is there's almost an emotional, historical, traditional barrier actually to the use of the acceptance of non-standard information. Industry, the risk assessors need to be educated to understand the new processes and also understand the limitations as well as the opportunities and possibilities for using this information. And a big call was that the processes, the methods for estimating the hazard should be standardized and ideally accepted internationally. Because in a way, if you're industry working out the properties of a substance, at the moment you can just send the sample to a test lab and the lab will do a standard study and you will know what to do with that result, and you will know that the regulators will accept it if it's a GLP study due to a standard method, etc., etc. But if you use these new techniques, it may be that you run the risk that the regulator won't accept that information. And in the last slide, I just want to give a few personal speculations on how I think that non-standard methods could be developed for use within a regulatory context. I think it's very important to integrate current methodologies into some sort of integrated assessment strategy or test battery or toolkit that's fit for purpose, reasonably standardized and yet reasonably flexible, that's reasonably acceptable worldwide. If you're going to use non-standard information, whoever's the assessor may be able to use it with a higher degree of uncertainty, providing they deal with that uncertainty in the risk assessment, possibly by having a higher assessment factor in the conventional risk assessment paradigm. I think a short-term goal could be to make use of the new approaches to toxicology, this is my last bullet point here, paradigms, to strengthen the case for categories and read across in a weight of evidence approach. And the final point I would make, which is the third bullet point here, is that there's an enormous amount of existing information, test data or published predicted properties in the registration database from ECHA, and this could be used to support read across and categories for subsequent registration, providing, of course, companies get permission to use that data. And it could be very, very useful to researchers to expand the chemical domains of application of existing QSARs. So with that, I will add the customary disclaimer that these are my personal views, and I will finish this talk and ask if there's any questions.